want to talk to you for a few minutes about hyperlipidemia. Hyperlipidemia, which is also called high cholesterol, is one of the risk factors for atherosclerosis, or narrowing of the arteries of the heart, which is also called coronary artery disease. There are many risk factors for atherosclerosis, and elevated cholesterol is just one of them. The other risk factors include cigarette smoking, diabetes, high blood pressure, male sex, and age. These risk factors tend to be cumulative, so that the more risk factors that you have, the higher the likelihood of developing atherosclerosis or coronary artery disease. Therefore, as we accumulate more and more risk factors for this, we tend to be more aggressive in treating each one of the components, whether or not it's elevated blood sugar, elevated blood pressure, or elevated cholesterol. Cholesterol is actually made up of three components. There is the HDL, which is the high-density lipoprotein, the LDL, the low-density lipoprotein, and triglycerides. These chemicals are made up of a protein and a fat along with the cholesterol molecule. The HDL is actually good to have. We want to have more of that, and one way to remember that is HDL, we want to be high, as opposed to the LDL, which is the bad cholesterol, we want that to be low. We also want the triglycerides to be low. The normal numbers for HDL are for men to be over 40 and for women to be over 50. For triglycerides, we want the number to be under 150. And for LDL, it depends on how many risk factors one has. In general, for most people, we want the LDL to be under 130. But if you have two or more risk factors, we want the LDL to be under 100. And if you're diabetic, we want that number to be under 70. If your HDL or LDL or triglycerides are not where we want them to be, the first thing is to figure out what the cause is of that, and then the second thing is to figure out what to do about it. For many people, the causes tend to be related to lifestyle. Perhaps not enough exercise, perhaps eating too much of the wrong foods, and perhaps being overweight. For others of us, the issue is really genetic. Our parents, our brothers and sisters might have had the same thing. We were just born with those genes, and genetics plays the major role. And yet for others, it's a mixture of genetics and lifestyle. So what can we do about elevated cholesterol? Well, it really depends on what the elevation is due to. If the elevation is in the triglycerides, what we try to do is have people increase exercise, lose weight, and try to avoid simple carbohydrates. Simple carbohydrates are breads, sugars, potatoes, simple starches, white rice, pasta. Try to avoid those and instead substitute vegetables and other complex carbohydrates, which are more difficult to digest and therefore do not cause wide swings in blood sugars. So complex carbohydrates could include whole grains, whole wheat, bran, oat bran especially, beans, as well as fruits and vegetables. The diet for HDL really does not play that big a role in trying to elevate it. Vigorous cardiovascular exercise has been shown to increase the HDL slightly. For the LDL, it's basically a healthy eating diet. We want to avoid fatty foods, greasy foods, fried foods, foods that are high in trans fats. And we also want to avoid milk, dairy fat, and animal fat. So milk products that have milk fat in them, and especially beef, we want to try to avoid. There are many medications that we also use to try to lower or normalize cholesterol. The most common of which is the class of medications called statins. Those include simvastatin, atorvastatin, which is Lipitor, and Crestor. Those are the three most common statins that are prescribed. These medications are extremely effective in lowering the LDL. The most common side effects of these medications are fatigue and muscle cramp. We periodically will monitor liver chemistries in people who are on statins, usually no more than once a year. There are other medications that we can use to lower the LDL, but the statins are our first line, and they are the most effective. For triglycerides, there are other medications that can be used. They're in the class called the fibrates. We also very often use niaspan, which can either come in an over-the-counter form, or niacin, which either comes in an over-the-counter form or a prescription form of niacin, which is called niaspan. The niacin is a B vitamin. The most common side effect is it tends to cause flushing. Some people find the flushing can be